Welcome to the Australian Dental Council 2026 Explainer podcast. So today we're diving right into the heart of operative dentistry. We're going to be talking about that crucial bridge every single clinician has to cross. You know, the one that takes you from all that foundational science theory to the skilled hands-on artistry you need every single day in the clinic. You know, this quote really just sets the stage perfectly for what we're talking about today. It's not just some casual observation, it's basically a mission statement. See, the goal isn't just to know about dentistry, right? It's about developing this intuitive, almost artistic command of it. So let's unpack how we get there. All right, so let's talk about the big challenge in clinical practice. What is that fundamental hurdle that honestly everyone faces, from students to seasoned pros? Well, it all comes down to bridging that gap, that very real gap between what you learn in a lecture and what you actually do in the clinic.
Yeah, at its core, it's really a translation problem. Think about it. You have to take all this abstract academic knowledge and somehow turn it into precise, effective, hands-on care for a real person sitting right there in your chair. This is literally where the science hits the pavement, where it meets the real world. And this really gets to a fundamental issue in how dentistry is often taught. In your preclinical studies, you learn about anatomy, oral biology, biochemistry, pathology, material science, but they're often taught as these separate, siloed subjects, right? The real challenge, and what this whole framework is designed to fix, is how you weave all those different threads of knowledge together into one cohesive clinical skill set you can actually use chairside. Okay, so we've identified the challenge. The next logical question is, how do we solve it? Well, the source material we're looking at proposes a really structured framework, one that's designed specifically to tackle this exact integration problem. And here it is, the key resource for our discussion today. This textbook is basically engineered to help students and clinicians do that heavy lifting, to reorganize all that compartmentalized knowledge. The whole idea is to create direct, practical links between all those different scientific fields, so you can actually use them in a clinical setting.
And you know, its application is actually really broad. This isn't just for first-year students. It's also a core guide for educators who are designing curricula, and it's a huge help for experienced international professionals who are getting ready for those tough registration exams. Basically, the framework is set up to build and validate this integrated skill set no matter where you are in your career.
Okay, so what does this practical approach actually cover? Let's take a look at the scope of the operative treatment that's laid out in this framework. What you'll see is a really clear logical progression here. It all starts with the absolute fundamentals, diagnosis and your instruments. From there, it moves into the whole philosophy of minimally invasive dentistry. And then it builds up to more complex procedures like intercorneal and finally, indirect restorations. It's smart, because each step really does build the foundation for the one that comes after it. And this really illustrates that critical starting point. Your operative tray. I mean, it's so much more than just a collection of tools, isn't it? It's your arsenal for both diagnosis and management, and knowing the precise function of every single instrument, and just as importantly, its limitations, that is absolutely fundamental to effective and safe clinical practice. So let's get a bit more specific. Take the dental mirror. It's a total multi-tool, right? You've got indirect vision, light reflection, tissue retraction, all in one. Then you have a straight probe, which gives you that crucial tactile feedback on surface texture and dentine hardness. Now, the Briault probe is a really interesting one. It's designed to detect cavitation between teeth, but, and this is super important, the source material really emphasizes using it with a very light touch. Why? Because if you're too aggressive, you can cause iatrogenic damage, basically harm caused by the exam itself. You could actually break through an early lesion that was in the process of remineralizing. And this just highlights a critical point. Real skill isn't just about knowing which tool to grab. It's all about the finesse of how you use it.
All right, let's shift gears and talk about what is arguably the philosophical core of modern operative dentistry. It's a concept that's absolutely central to this whole problem-solving approach.
And that concept is minimally invasive dentistry, or MID. The definition couldn't be clearer. It's a philosophy of maximum preservation. The number one goal is to keep as much healthy tooth structure as you possibly can. And you achieve this by shifting your focus, moving it towards prevention and remineralization, making actual restoration a minimal, really targeted intervention.
And this protocol is a perfect reflection of that MID philosophy. If you look closely, you'll see that direct intervention is just one small part of a much bigger cycle. The whole process starts with arresting active lesions and actually trying to remineralize them first. It's only if restoration is absolutely necessary that it's done, and even then, you're using minimal cavity designs. And what's really crucial here is that the protocol also includes repairing existing restorations that are defective, plus continues disease monitoring. It's a huge shift towards a more holistic, long-term way of thinking about patient care.
So, what's the big takeaway? The crucial point is this: MID is a true paradigm shift. We're really moving away from that old drill and fill surgical model. And instead, we're moving towards a much more nuanced, biological, and preventative strategy for managing caries.
And all of this brings us full circle. We're right back to that central challenge we started with, and what the ultimate goal of this whole framework really is.
This really captures the essence of the journey, doesn't it? The whole goal of this practical framework is to help you make a transformation, to go from having all this separate, compartmentalized knowledge to having a fluid, responsive, and totally integrated clinical ability.
And that right there is the destination. The end point we're aiming for isn't just being competent, it's achieving a kind of artistry. It's that moment when your problem solving becomes so ingrained, so well integrated that it just feels innate. That's when you, as a clinician, can respond to any unique challenge with confidence, with creativity, when you've truly mastered your craft.
So, we'll end with a question for you to think about. By really understanding and applying these kinds of integrated frameworks, by consciously working to bridge that gap between theory and action in your own daily work, how can you cultivate this innate clinical art? For more insights into the future of reconstructive medicine, please subscribe and share this update.